Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Fibroids are abnormal growths that develop in or on a woman's uterus. They're typically benign, not cancer. Sometimes fibroids become quite large and cause severe abdominal pain and heavy periods. But in other cases, they're present, but they don't cause any symptoms.
According to the National Institutes of Health, up to 80% of women have fibroids by age 50. 80%!
Right. Well, you got a 4 in 5 chance of having them.
The NIH reports that more than 200,000 hysterectomies are performed each year due to the symptoms of uterine fibroids. And here to discuss is the Division Chair of Gynecology at Mayo Clinic, Dr. Shannon Loughlin-Tomasso. Welcome to the program. It's very nice to meet you.
Thanks for having me.
You said you could talk about fibroids for hours. Is that true?
That is true.
Why is it of so much interest to you?
Well, I think that fibroids are, they're common, as you mentioned, but they're also fairly unique. So each fibroid is a little different, and our patients show up with just a myriad of symptoms. So I feel like I could talk about them for hours.
So just so we all understand, when you say fibroid, what do you really mean?
Well, fibroids, as you mentioned, grow in the uterine cavity, and they arise from the muscle layer. So they're an abnormal growth within the muscle layer, and they can get large. Some of them stay small. Some grow into the uterine cavity, and some grow on the outside of the uterine cavity. So there are actually probably a variety of different kind of fibroids, but we generalize them as this abnormal growth of the uterus.
But they are benign.
They are
not
benign.
Cancer. Do they ever turn into cancer?
That's a little bit of a debate. There is a condition called leiomyosarcoma, which is a cancerous condition of the uterus. It arises in a large tumor within the uterine cavity. And so there was some research that indicates maybe there are some types of fibroids that are more at risk for becoming leiomyosarcoma, but they also may just appear as a unique, separate tumor.
You said there's lots of different kinds of fibroids. Is there a number? Like, is there 10 different ones? How many are there?
We don't know yet. We're just learning about the genetic differences within fibroids now. There are several types that have been found, and they probably are related to how big the fibroids get and what symptoms they cause, but we haven't learned everything about them yet.
So are fibroids like a cancerous tumor in that they have their own genetic makeup?
We think there are different types, yes. So there are about 70% of the fibroids that are removed from the uterus are this one kind of mutation called a MED12 mutation. But there are other fibroids that might be associated with a cancerous condition of the kidneys, and there are another kind of fibroids that grow very large, and they have a different genetic makeup.
They're so common. Do you have any idea what causes them?
We're not completely sure yet. We know that there are stem cells within the uterus, and those stem cells can either turn into normal fibroids, or they can create normal muscle tissue, or they can create a fibroid. And we're looking for what triggers that, because that would be a great option for preventing growth of fibroids if we could intervene at that point. Some of the things we know that cause fibroids is you basically have to have estrogen and progesterone to cause the fibroids. So they don't occur in women before puberty, and they should not occur after menopause.
And obviously, if you've had your ovaries removed, are they less common? You said that you have to have estrogen and progesterone. So women who have had their ovaries removed for whatever reason, are they less likely to get fibroids?
Yes. And in fact, we would consider those women menopausal. And so if they get a fibroid after menopause, that would be more concerning for that leiomyosarcoma we mentioned.
Is there any part of the patient population that is more at risk? I mean, obviously, after you start your period, before menopause, any other risks in there?
Yeah, women, African-American women are much more at risk for uterine fibroids and are at risk for symptoms and for them to occur at a younger age. So they're 7 times more likely to need their fibroids removed. And as you mentioned, hysterectomy is very common. It's about 2 to 3 times more common among African-American women. Also increasing age up until the age of menopause. So women in their 40s are more likely to get it than women in their 20s. And women who haven't had a lot of pregnancies before are more at risk. We also think low vitamin D is a risk factor for fibroids.
So low vitamin D, and you said fewer pregnancies. Women who have had more pregnancies are less likely to get fibroids?
Correct.
Well, and why is it of concern? I mean, there are a lot of women who I presume have fibroids that don't know it, but there are some who have symptoms from their fibroids, and if they do, what are the symptoms?
Well, the most common symptom is heavy menstrual bleeding. So the period can last longer than 7 days and sometimes be so heavy that women have to schedule work or activities around their period. Some don't leave the house during the heaviest days of their bleeding. So they can get very severe. The biggest complication we worry about is anemia. And as you mentioned, some women may not know they have fibroids, and they may not recognize that their periods are heavier than other women. And so they may live with some anemia for some time. Some women get so anemic they need blood transfusions.
Biggest complication, anemia.
Mm-hmm.
So so much bleeding that the hemoglobin goes down significantly.
Yes.
That's a more common complication than pain, for example.
Yes, we tend to see that more than pain.
So what is it that you finally figure out, or the woman finally says something's wrong and comes in? I mean, I can imagine, if your periods change, you think, well, this is what my periods are going to be like in my 40s, no big deal, what is it that finally brings them into you? Do the fibroids get so big that they become an issue?
Sometimes they do get some pelvic pressure, or it starts getting so large it starts pressing on other organs. So you can have increase in your urinary frequency, increase in constipation, or some women get fibroids so large they appear pregnant, or have to increase their pant size. For bleeding, most women will start to recognize that their bleeding has changed so significantly and mention it to a physician, and the physician will say, well, that is abnormal. So a lot of women will describe kind of a gushing type bleeding where they literally can't leave the bathroom or their house at that time.
And what's the natural history? Once you have a fibroid or fibroids, do they tend to just gradually grow over time, or do they sometimes quit growing, or do they sometimes shrink?
All of the above.
Oh my goodness.
This is somewhat of a mystery with fibroids. The NIH performed a fibroid growth study, and I got to be part of that study. It was very interesting. We followed women, and we actually saw some grow very rapidly, some stay the same during the entire study, and some shrink spontaneously. So I often liken them to teenagers. They sort of grow through these growth spurts and then kind of stay the same and then go through another growth spurt. But not all fibroids grow. Some remain the same, stable, and asymptomatic. And we're actually looking into causes of which fibroid, or if we can tell which fibroids are going to stay stable and which fibroids are going to need treatment.
Can you tell with regard to abnormal bleeding, is that the most common cause of abnormal uterine bleeding, fibroids, as opposed to, let's say, cancer of the uterus?
It is more common than cancer of the uterus. In fact, more hysterectomies are done for fibroids than they are for cancer. It is one of the most common causes, yes.
What if it's not affecting your, bleeding? It doesn't affect your periods. You don't have to go up a pant size because, oh my gosh, would that be traumatic? Way more than a terrible period. Do you always have to treat the fibroids? Can you do kind of a watchful waiting? First of all, how would you discover that someone has a fibroid if it's not really causing them trouble?
Yeah. A lot of them are found incidentally. So if a woman has an ultrasound for any other reason, they might see a fibroid. And we try not to treat asymptomatic fibroids, actually. So no symptoms, no treatment, because all treatments, including medical therapy, have either side effects or risks. So we really try to individualize the treatment for treating the right fibroid and treating the right symptoms. And sometimes we may even treat one fibroid in the uterus, but not others if they've been stable.
Is it more likely that a woman will have more than one fibroid? If she has one, is she more likely to have two?
It is more common, and that is also more common among African American women. But as you increase in age, it's more likely to have two than one.
Is that the easiest way to diagnose a fibroid, is by ultrasound?
Yes.
So it's non-invasive, it's quick, it's cheap. You don't need to do an MRI or a CT scan, for example.
No, we don't need to do that. We usually do, we call it minimally invasive imaging because it is usually a transvaginal ultrasound. So the probe does go in the vagina. That's the best way to diagnose where the fibroids are. But you can start with an abdominal ultrasound too. It is the most common imaging technique that we use, and because, as you mentioned, it is cheap and fairly easy to get done.
Okay, and you can do it either way. Abdominal, so where you put the probe on top of the abdomen, or you can do it through the vagina.
Yeah. Yes, but the through the vagina one is usually more, it gives you better size and location of the fibroids.
All right, we're talking about fibroids with Mayo Clinic obstetrician and gynecologist, Dr. Shannon Laughlin Tomaso. Time for a short break.
When we come back, we'll focus on treatment and research and a myth or matter of fact. If you have fibroids, you can't get or stay pregnant.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
We are back talking with Dr. Shannon Lachlan-Tomasso, an obstetrician and gynecologist and a division chair in the Department of Gynecology at the Mayo Clinic in Rochester. And our topic is fibroids, but we've got a myth or matter of fact.
That's right. If you have fibroids, you will be unable to get or stay pregnant. Is that a myth or a fact?
Myth, for sure.
Why do people think that?
Well, fibroids can cause some complications during pregnancy if they're really large. They can cause the baby to be in the breech presentation. Other people think they might be related to early deliveries. But a new study just came out that looked at whether or not they're related to miscarriage, and they didn't find a relationship between fibroids and miscarriage.
Well, that's a good thing, but sometimes they're large enough that it causes a problem with the fetus.
It can cause, yes.
So you said breech position. So the baby doesn't get in the right position because there's not room there in the uterus? The fibroid's taking up part of the space?
That's correct. They kind of can get in the position in a lower uterine segment fibroid, low down in the uterus. That baby can kind of be pushed up to the top. But those are pretty rare. We actually found that about 11% of women go through pregnancy with fibroids with no issues at all.
If you have a fibroid and if it gets removed or not, are you more likely to develop a second fibroid? A third, a fourth? I mean, as you go through your 30s, 40s, 50s?
Yes, we do think that they're going to occur again. So even if you get your fibroids treated, there is some recurrence risk.
So you talked about the fact that some fibroids don't necessarily need to be treated. So which ones do?
We always start with the patient's symptoms, and then we look at the imaging. So as you mentioned, we usually start with an ultrasound. And if the patient presents with heavy menstrual bleeding, we'll look specifically if the fibroid's impacting the uterine cavity. So if it's partially or fully inside the uterine cavity, that fibroid can usually be treated surgically through a fairly minor procedure. We go in through a scope, through the vagina into the cervix, and take that fibroid out without affecting the rest of the uterus and with no abdominal incisions.
So through the vagina, through the cervix, up into the uterus, and you can take it out from the inside?
Yes. So that's called a hysteroscopic resection of fibroids.
Hysteroscopic?
Yes.
Because you use a scope.
We use a scope,
Okay.
a uterus scope.
All right.
Wow, you're good.
I put that all together.
You sure did. Why is it that if you have a fibroid, you get a hysterectomy? Couldn't you just do what you just said?
Yes.
Is that not as common 10 or 15 or 20 years ago? They just did a complete hysterectomy when there was a fibroid?
Yes, and we actually try to reserve hysterectomy for women who have tried other modalities, even medical therapy, and it hasn't worked for them for some reason. We try to delay hysterectomy as long as we can now. There are lots of different treatment options that you can try, and a lot of them are highly effective, so you don't necessarily need a hysterectomy anymore.
So what are some of them?
Well, for heavy menstrual bleeding, if the fibroid's not completely or partially in the cavity and doesn't need to be removed, you can actually start with medical therapy. So there's non-hormonal options that you just take during your period, and then there's hormonal options that usually you take all through the menstrual cycle. And both try to decrease the amount of bleeding. The progestin-containing IUD actually works very well for heavy menstrual bleeding and can reduce bleeding by about 70%. The hard part is with fibroids, they're a little bit more at risk of the IUD falling out. So you have to be cautious about that.
Can something like that, though, then reduce the size of the fibroid? If you're doing, introducing progesterone that wasn't there before, does that make the fibroid shrink?
It doesn't usually.
Okay.
Some studies have looked at whether or not it would shrink, and it not universally.
Okay.
So the options that you have mentioned from a medical standpoint are medications including hormonal, non-hormonal, and also you talked about an IUD. Other options
Yes.
for short of surgery?
Yes. There are lots more options even short of surgery. So with large fibroids that cause the bulk symptoms, those symptoms that are like constipation or urinary frequency or the looking like you're pregnant kind of symptoms, those can actually be addressed also along with the bleeding by either uterine artery embolization, focused ultrasound.
Okay, uterine artery embolization.
Yes.
Can you explain that?
Sure. So that's a procedure. It's a radiologic procedure. And they go in through the blood vessels in the groin, and they go around with a catheter, kind of the same way that people get a heart catheter. And they put these little tiny gel spheres in there to block embolic agents, to block the blood flow to the fibroids specifically. Wow. And it will decrease the size of the fibroids and decrease symptoms.
Because you cut off its blood supply.
Exactly.
Wow, pretty interesting.
It's hardcore.
Now, what about cryosurgery or cryotherapy, where you actually stick a needle into the thyroid and burn it or freeze it? Do you use that?
That's much less common. That used to be used a lot, but there's something very similar now, which is a radiofrequency ablation of fibroids, and that is done laparoscopically. So you can go in with a small incision surgery, and using ultrasound guidance, they put the little probe inside the fibroid, and they use radiofrequency energy to shrink the fibroids.
So you have got a lot of options when it comes
Yeah.
to treating fibroids.
And there's one more,
Okay.
if you want to hear about that one.
We do, and we've got time. Lay it on us.
So that's the focused ultrasound ablation, and that one is MRI based, and the women actually lay on their abdomen in an MRI with no incisions at all, and they use ultrasound waves to shrink the fibroids.
And how do you decide what to do?
Well, a lot of it comes down to where the fibroids are, how many there are. So we make some individualized decisions based on the symptoms and the location and size of the fibroids. And we have a whole team here at Mayo that reviews the fibroids and the imaging together. And together we work on deciding what's the best treatment option for the patient.
So if the medications don't work, and if the plethora of possibilities that you have just gone through don't work, then surgery, you have to remove the uterus, I presume?
Well, there's one more surgical option that you don't have to remove the uterus, and that's called myomectomy, which means removal of the fibroids alone. And that's been the gold standard for women who have large fibroids that also still want to get pregnant.
But you talked about removing a fibroid through the vagina.
Mm-hmm.
Is this are you talking about a different kind of operation now?
Yes. So there's an abdominal procedure where you can remove those fibroids that grow on the outside of the uterus or are really large. And that can be done either through the laparoscope or through an open incision.
So you can do it from the inside, you can do it from the outside, and if all else fails, you can take out the uterus.
Yes.
But that's not as desirable anymore, or I guess as it used to be, right? I mean,
Correct.
why is it important to keep your uterus as long as you can?
Well, a lot of women want to keep it for fertility purposes,
Sure.
obviously. But we also have some new research that looks at the uterus. When the uterus is removed, it does affect ovarian function. And so there's an increase in long-term cardiovascular disease risk because it might put women into menopause a little earlier.
Well, yeah, but you don't have to remove the ovaries, do you?
Even when you conserve the ovaries. So when you remove the uterus alone, it can affect the ovarian function even if you've left the ovaries in.
Really? Now, we didn't know this a decade or two or three ago, did
Right.
we?
Well, the studies that came out originally kind of showed a lower age at menopause for women who had their uterus out, even if they had conserved their ovaries. But the new long-term research is within the last few years.
So if you have your uterus removed, your ovaries don't work as well. Is that what you said?
That's what we're thinking, yes, because of the increase in cardiovascular disease down the road.
We're almost done, but before we go, if a gal's mom had fibroids, is she
One of your friend's mothers.
Yeah, I got a friend. Is she and her sisters, grandchildren more likely to have fibroids?
Well, we think that's true, but it's a little hard because fibroids are so common. So we haven't seen as much of a correlation if they have a really large fibroid. That doesn't always occur in the next generation.
I'll let my friend know.
Well, we have learned a lot about fibroids. Dr. Shannon Lachlan Tomaso, you are fabulous. Thanks so much for being with us.
Well, thanks for having me.
Dr. Lachlan Tomaso is a division chair in the Department of Gynecology at the Mayo Clinic. Thanks again.
Thank you.